Go.
Hi, my name is Brandon Thompson, and I'm going to show you how to appropriately place or properly place an IV catheter. So we have our patient here. We're going to place an IV catheter in the front right cephalic vein. So we'll go ahead and have my assistant here, Gage, help holding for me. So I'm going to go ahead and prep the area. And we want to start as low as possible. So I'll be shaving down here. Oops. Alright, we got our area clipped. Now for any catheter placement, you definitely want to prep the area as if it's a surgical procedure. So we'll go ahead and do that with our Chlorhex. Do a nice sturdy scrub right here. Just get all the hair and dirt off first. Our alcohol. One more time for cleaning. Then we have our sterile gauze right here. I'm going to use one piece of it to help dry the surrounding area. Alright, so we're going to go ahead and place the catheter. I have all my materials ready here. I have a 20 gauge Tamaro over the needle catheter here. I do have it flushed with some heparinized saline solution to help visualize the blood when it goes into the hub. And I also have my catheter cap here and my heparinized flush. I also have an extra catheter here just in case. I have my sterile gauze to help place the catheter. My tape is up here, and I have my Coflex to go ahead and finish the bandaging. So I'm going to go ahead and place the catheter. You want to get closer just to visualize it. So as you can see, the vein is pretty visualized right here. I'm just going to start as far distal as possible. So I'm going to go ahead and insert. I'm going to go in, I went in just a few centimeters, I am going to go in just a little bit more. And then I'll advance the catheter into as so. Oops. Gauge here is holding off for me. There we go. Go ahead and keep it pressed up in there just so it doesn't come out. Let me get my tape. Tape it in. Alright, so I'm going to put the bottom of the sterile gauze right on top of that area just to make sure that we prevent any type of catheter related infection here. And I'll go ahead and tape on top of that as well. Okay, so I'm going to go ahead and switch to the cap. Oops. Oops. You got to hold the elbow out. Can't. Okay. We have our cap placed. I'm going to go ahead and check it just to make sure it's patent with our flush before I completely secure it.
You're good?
Alright. I do have a little bit of a mess here. Apologize. Alright. Go ahead and secure it in place. And then we will end with our Coflex. Now I do know that in the veterinary clinical handbook for veterinary technicians, it does say to completely bandage the entire paw, but this is going to be a temporary catheter and will not need that. It will not be placed very long. So that is how to properly place a catheter for intravenous intake for a front right cephalic vein. Thank you.